So this is our patient. We're going to blur her face, but can you tell me a little bit when this? she just made an interesting face there. But when did your heart start beating fast? Yep.
About 11:15.
About 11:15 today. All right. And you were, and tomorrow you were actually going to get an ablation procedure.
Correct.
All right. And so you were taking off your medications and
Waiting for the procedure to be done.
okay. All right. So in a minute we'll be doing that. We're going to do propofol. Are we all set for the procedural sedation?
We are.
And you understand this will be on YouTube, but your face will be blurred. So.
That's right.
All right. Now we actually have the pads on your chest already. Do you mind being on?
Yeah,
okay. What voltages are we going to use?
I believe we're going to do 50 joules.
50
synchronized
joules?
shock
Okay.
to start with.
All right.
Side run a strip. Does it have a printout? Printer? There you go.
Our cardiologist is standing here at the bedside, leading and directing this procedure. Do you have any words of wisdom?
One learning point is we like to tuck in patients' arms gently.
Oh,
so
good
that their
point.
arms, when they're cardioverted, don't bump up and minimizes the risk of hand or finger injury on the side rails.
Very good point.
Something you learn when you do a lot of cardioversion.
Okay.
So tuck you in snugly.
All right.
Not too snug. Just to help prevent the fingers from flipping up.
Flopping up.
You'd be surprised. Yeah.
Okay. Anything else you do?
You have to make certain the patient hasn't eaten recently. Obviously, this is an urgent indication. She hasn't eaten since very early this morning. Got to make sure you have all the appropriate stuff to support her airway nearby when you do deep conscious sedation like this. And be ready and prepared to record her rhythms after she cardioverts, so you can document what her post-cardioversion rhythm is. Sometimes we cardiovert people from atrial fibrillation to atrial flutter, and then they require more cardioversion. So it's important to see what the strips are after the cardioversion itself, even if they remain in the arrhythmia.
Okay. And then how do you put your pads on? Is this anterior, posterior?
This is a typical anterior posterior location. Occasionally we'll do side to side. Okay.
And that tends to work best as far as you're concerned?
It depends on the body habitus, but
okay.
For someone with her type body habitus, this is a very acceptable pad location.
Yes, sir.
Okay, suction's ready. Airway equipment's all ready. All right, end-tidal seal 2 is on.
Working on that one.
Nursing staff, do you mind being on YouTube or?
Nope.
Nope? Okay.
Something ugly about me.
Oh no, you're all gorgeous.
Don't zoom in. Yeah, I'm wondering where the crash cart is.
This is an emergency room.
We got plenty of crash carts.
I know.
The whole room's a crash cart.
All right, here we go. It's game time, sleeping time. Jessica, tell me what you're doing as far as your...
I'm going to give her 1 milligram per kilo of propofol.
Okay.
When do I start the burning?
Any moment. You may be one of the lucky ones that doesn't burn.
It just feels full. It doesn't feel like
What? One more? I'm going to give the other 20, and then I'll leave the others.
Cycle or blood pressure for you real quick.
it's just cycled it.
Oh, you did? Okay.
Yeah.
Because that doesn't make any sense.
How you feeling?
Getting sleepy? I think she's...
Okay, everybody ready? Everybody clear. So 50, Frank.
50, sir.
Charging 50, everybody clear.
Clear, clear.
Go.
Got it.
Converted.
Sign both. Thank you.
out?
Cycle or blood pressure? Cycle or blood pressure. Make sure. There you go.
Heart rate. 100 heart rate. Yeah. And 100%.
82. Yeah, good idea. There you go.
There's a little oxygen.
There we go. We're seeing it.
Maggie, we're done.
All right, we're coming up.
Hey there.
So did it stop? Did you? So whatever you give it, you have to be ready to do it. Or you gotta be ready. Yeah. Something about propofol is such a short-acting drug.
Cranks, I'll be back in 1 minute.
Yes, sir.
There you go. It's all done.
Hello? It's Kim.
What's that?
I don't
It's
know.
all
I'm in
done.
the middle
Yeah.
of
We're back in a normal
That's
rhythm.
okay, it's fine.
You got a note or something you can mail them around?
Yeah, that's it.
Did you zap me?
We zapped you.
Yeah.
You guys are awesome.
I'm gonna repeat your EKG, okay? Make a little hole.
Okay.
You didn't feel anything at all.
I didn't feel anything.
Perfect. You hallucinated?
We're up here on
Well,
the
yeah,
belly.
I mean, it was like a dream state where I was following links. I mean, I was just going to different sites,
Yeah.
you know, that links to news sites.
Yeah. So you were just cruising the internet
I
while
was
you were
cruising the freaking internet. And what did I say?
Nothing,
Oh my God,
nothing.
These right wingers, look what they're doing.
You didn't say a word. You were quiet as a church mouse. You briefly slowed your breathing down, and so that you were just your pulse oximetry dropped down.
So what?
Did it down to in the 80s?
Yeah.
In the 80s, but we put you on oxygen and you popped back up.
Okay, important things to consider when performing an urgent cardioversion is confirming when the patient last ate or drank, ensuring whether they are hemodynamically stable or unstable, ensuring that you have proper airway management equipment on hand, ensuring that the personnel administering conscious sedation are comfortable doing so and authorized to do so, unless it's an emergent cardioversion, in which case you would do it in a setting of hemodynamic instability where the patient was unconscious, and then also ensuring that you have the proper code cart materials on hand to perform any further resuscitation should you cardiovert the patient from one arrhythmia into another, which occasionally happens. When we cardiovert people, we find that an ounce of prevention is worth a pound of cure, and that having all the ducks in a row and being set up and prepared to handle any further cardiac event that occurs after a cardioversion, they very rarely occur, but if you're prepared, the outcomes are almost uniformly very successful.
Thank you very much.
Okay.